So let me just give you a guided tour into one of our operatories. You will notice, and many of you have asked me in many of the videos, that our operatories are a bit different from what you see conventionally in most clinical practices. And why is it different from most clinical practices? So I thought this video will go through some of the design elements and also some of the components, why they are in a certain way, so as to differentiate our practice from many practices out there. So let me take you through one by one. The first thing you notice when you see an operatory like this is that it seems way more open than a lot of practices out there. Why is it that way? It is intentional. We follow sort of a minimalistic design. So the first thing we want to make sure in most operatories is that it has to be a dual entry. So we have two entrances here, one through which the patient enters. Then you have another entrance, or exit rather, where the assistant can go in and out to bring in tools. So this part is usually used only for the patient entry. And when the patient walks in, the first thing they will see is that the operatory is very minimalistic. We try and do whatever we can to eliminate this feeling or this appearance of it being very crowded. Because remember, when someone walks into the clinic, they tend to form opinions in the very first 20 or 30 seconds. And if you tend to have a very favorable opinion the first time someone enters, then that tends to remain in somebody's mind. But if the initial impressions are poor, then it's usually very difficult to overcome that initial impression. So we pay a lot of attention as to how the operatory appears when a patient walks in. We want the patient to feel that the area is much open and we're not putting them into some sort of a confined area and boxed in. So how we achieve that is we try and avoid as many arms as possible in the operatory. So if you look at the operatory, you will find there's only one arm because it's a microscope-based operatory. That arm is already a big one. So we try and eliminate all the other arms. And what are the typical arms which are there in most operatories? One is the chair light. So you find that we don't have a chair light because we do everything through the surgical microscope. If at all you have a chair light, then you want to make sure that it's not clashing with the microscope arm. So that's point number one. The second arm, which tends to crowd most operatories, is the X-ray arm. What we have done is we've switched over to a cordless X-ray machine, a handheld one. So again, it eliminates one arm completely. So that again adds to the roominess. The third thing, if you see the dental chair, it doesn't have a spittoon. So we don't see the need for a spittoon. Most people just accept that you need a spittoon, otherwise you can't do dentistry. In reality, you don't need a spittoon because why should anyone keep spitting? But if at all someone badly needs to, then we move the spittoon to a separate area, a small kind of attachment, which is from dirt. So that's the third reason why the whole operatory looks much more open. And then the fourth reason, of course, is we don't have a chair-based arm. So most typical clinics tend to have an arm-based operatory where the arm is attached to the dental chair. And then when you bring it across to the patient is kind of boxed in there. So you have this kind of an appearance that somebody is going to be caged inside during treatment. That adds to anxiety. What we have is a cart-based operatory. So this cart and all the attachments that you have is independent of the chair, again adding to the roominess, because when the patient walks in, you have the freedom to move the cart out of the way like you see here. So the patient walks in to a chair completely open on all sides. So that's the initial impression the patient gets, and that helps a lot in reducing anxiety. Once the patient sits in the chair, then yes, you can bring in the cart from the side and move it in place. But even when you are working, the patient is never boxed in the way they are in a typical arm-based setup. So that's a huge difference in this operatory compared to a typical dental operatory. And then some of the other components is our chair. It tends to swivel. So you can rotate this from side to side. So it gives you a lot of flexibility. In this case, we're using a surgical microscope. And when you use a microscope, if you have a swivel chair, then you don't have to keep moving the microscope. The other big difference in a swivel chair is that, let's say you're working in one position, and once you're done with the procedure, you want to have a discussion with the patient, then you have this opportunity of just rotating the patient completely like this, and then make the patient face the cart. And then as you are explaining something, you can position the patient according to what you want. So the swivel really helps us in that way. Of course, memory foam everywhere so that the patient's comfortable. And then the other big difference that you see here is the back wall of the assistant. Now in conventional setups, because you have a spittoon and the suction is attached to the spittoon, the assistant has to shuffle between turning to get the suction and then moving towards the patient who's going to be down here. But in here, what we did was we made the back wall and the suction attached to the back wall. So the assistant is always facing this side, and everything he or she needs will be at an arm's length. We call it the circle of influence, which means the idea is that the operatory has to be designed in such a way that once you start the procedure and you start working on the patient, whatever the operator and the assistant needs should be at an arm's length. They don't have to keep getting up and reaching out for stuff. Everything they need should be in one place. That's the concept. So you have a back wall here, and you have a tray which is retractable. So the assistant can use this entire station to perform whatever mixing or lay out the instruments that they need before the procedure. And then for each procedure, we have these trolleys. So you have multiple trolleys for each procedure. If you are doing, let's say, a restorative procedure, for example, we have all the tools you need for restoration in one trolley. And let's say the next procedure is, say, an extraction or something related to surgery, then this trolley can go out, and then we bring in a surgical trolley, which usually has most of the things that you need for surgery, and so on. So you can keep changing trolleys depending on the procedure, and that trolley goes underneath. So we feel this is a much more ergonomic way of performing regular dentistry, everyday clinical dentistry. By the way, this started as a endodontic practice, but as time went by, we moved over from endodontics practice or referral practice to a completely general practice. So today we do everything in general dentistry, not just endodontics. We do restorations, we do crown preps, we do surgeries, we do extractions, we do implants, we do everything in general dentistry in this operatory. There is no procedure that you cannot do with this kind of setup. Some of the other components that you see, as I mentioned, we have a cart-based operatory. So a cart gives you a lot of flexibility. All the tools that we need is attached to the cart, including your hand pieces, your scalers, your RVG or digital radiograph system. You can have your sensor, which is connected to the port, which has a CPU on the inside. The cart enables you to have a computer on the inside. So the digital X-ray is connected here. The photographs that you see that we click through the microscope, that too is connected into the CPU here. So we have a system where whatever documentation you do, including the X-rays, the pictures, everything gets captured into the CPU on the cart and is on display on the monitor here. Again, the monitor has a lot of flexibility when it comes to cart-based systems. You can change the size of the monitor depending on your preference. What we do is we took the largest monitor available because you have the option of opening multiple windows. So if you see now here, you have the microscope pictures, you have a cone beam CT here, and then you have a radiograph software here. So depending on which one you want, you can maximize it and then work on it and then have a discussion with the patient as we showed in the earlier sequence. So the cart is a very, very important component. It helps us put everything in one place and then make it very easy for us to document, reduce the clutter, give this sort of minimalistic look, and also facilitate patient discussions. The X-ray machine, very important because once you have a very large arm for the X-ray, that tends to clash with everything else. So a lot of those headaches are gone when we switch to a handheld X-ray machine. So we use that in the operatory. And when it comes to storage, a lot of people go for these custom cabinets, which typical dental clinics have, where you have cabinets on the side. We feel the cabinets on the side are wasted because every time you want to go there and reach for it, then the assistant has to walk up to those cabinets. So what we've done here is we've put IKEA kitchen cabinets. So IKEA has a whole range of kitchen cabinets. So depending on what you want in your clinic, you can buy your individual sizes. For example, this is one cabinet, this is the other cabinet, and they can be spaced together, closer or apart, depending on your operatory dimensions. If you look at some of our other operatories on that side, those are smaller operatories. So what we've done there is we have selected cabinets and then move them a little closer so that this distance is lesser. We can even select smaller cabinets if the operatory is very small. So they do give you a lot of flexibility. And the part in between, you can ask a local carpenter to customize these. These attachments are from Dur, the high vac attachments, and they can also be moved. If you see here, we try to experiment by putting it here, the whole unit, and we found that wasn't very convenient. So we actually unscrewed it from here and moved it here. That's why you see those marks there. So we do a little bit of experimentation. If you're not happy with one ergonomic position, then you can always have the flexibility to move it around a little bit. And finally, the microscope. So we do everything through the microscope. there is a way to do this. We do general dentistry through the microscope, not just endodontics, everything in general dentistry, including clinical examination, oral prophylaxis, restorations, crown preps, even extractions we do through the surgical microscope. And we teach you how to do most of these things in our online course. And if you see, there's a camera here and there's these attachments through which you can have live HDMI output on the screen for the patient's assistant to watch. You can check your clinical pictures on the screen. So you can have as many screens as you want. We have just one because we have an assistant scope on the scope. So the assistant can actually see through this. Some operators prefer to have a monitor for the assistant. So you'll find extra monitors on that side so the assistant can watch through the monitor, but we prefer an assistant scope because that's much more involved for the assistant because they can see things in real time. As far as the depth of field is concerned, it's much more easier when you have an assistant scope rather than a monitor. And the other reason why this operatory appears far more roomier than it is we have planned it in such a way as to where to mount the microscope. Because remember, the microscope is this huge tool and you can't just bring it into an existing operatory and plug and play. You have to plan it. You have to know how it interacts with the rest of the components here. And then if you see here, we have planned it and put it as a ceiling mount, and we have installed it in a particular position so that it's very easy for us to bring it from a parking position into a working position. And once we have done working, we know how to park it back. It's not a big effort. I can just easily bring this inside, use it. And then once I'm done using it, it's very easy for me to just park it like this in one motion. I don't have to struggle a lot. I just park it like this and then go and start talking to the patient. So this whole mechanics is something that we have planned. It's not something that's just random. And this is exactly what we teach you in our online course, how to incorporate the microscope ergonomically into your existing operatory. If you want to know more, then the links of which are coming up here, do have a look. And then you too can implement this in your clinical practice. Check out the online course. It's called Microscopic Dentistry Simplified. I made it very, very simple for virtually any dentist, any general dentist out there to move from traditional operatories into a more ergonomic microscope-based operatory. If you'd like to know more, then do check out the links that are coming up. If you like more content like this, then don't forget to click on that subscribe button so that you get notified every time I upload a new video. If you found this content useful, then do share it with friends who you think might find it equally useful. And I'll see you next week with another video.